As per my introduction, I am the Communications Manager at the Caribbean Public Health Agency, CARPHA, and we are headquartered in Trinidad and Tobago in the Caribbean. We also have two campuses, actually, one in St. Lucia and one in Jamaica. So I know that most, if not all of you, may have not heard of CARPHA. So I'm going to just tell you a little bit, not too much, about who we are. So who's CARPHA? Well, CARPHA is the Regional Public Health Agency, and we are solely for the Caribbean region. We serve 26 Caribbean member states made up of English, French, Spanish, and Dutch-speaking territories. And we are currently leading the Caribbean's COVID-19 public health response. We also support the CARICOM region, that is the Caribbean community, through health security, and we facilitate opportunities for resource mobilization. We also provide risk communication guidance. We provide advice to non-health sectors, and as I had previously mentioned, CARPHA is coordinating the public health response for the region. As a region, I must tell you that we face similar challenges, not only to the world, but challenges to each other. However, we also have different socioeconomic, political, and cultural circumstances which may lead to different factors that affect our vaccination coverage and also our uptake. So how are we looking on the COVID-19 front in the Caribbean? Well, I will talk to the Caribbean as a whole, which includes the CARPHA member states, and we're seeing that we have over 2.15 million cases as at November 22nd in the Caribbean. That's about 35 countries or territories. And when you look at the deaths, we're seeing over 26, maybe on the closer side to 28,000 deaths. And vaccinated persons, over 23 million, 23.3 million, and that is in the Caribbean, including CARPHA member states. But when we look at CARPHA member states alone, which are the 26 countries or territories, we have close to 443,000 cases and with just under 10,000 deaths. Vaccinated persons stand at close to 3.2 million. One of the strategies that CARPHA, as the regional body, used to determine the attitudes of Caribbean residents towards immunization with the COVID-19 vaccine, we wanted to assess beliefs and opinions about COVID-19 vaccines and the potential barriers to acceptance, and also to identify trusted sources of information and existing information gaps in CARPHA member states, information gaps on COVID-19, and also on the related vaccines. The results that we would get from this survey would be used to support CARPHA member states in the development of their public education campaigns and the dissemination of multimedia communication materials about these vaccines. So from the 17th of February to the 18th of June, 2021, CARPHA conducted this survey among social media users aged 18 and above who actually reside in the Caribbean. Although all the member states participated in the survey, what we found is that only 6 achieved the target sample size. And those 6 were Barbados, Curacao, Guyana, Jamaica, St. Lucia, and Trinidad and Tobago. So 74% of persons, 74% of persons responding in the survey indicated their willingness to accept the vaccine when it was made available to them, and 15% indicated that they were hesitant, and then we had another 11% who said that they refused the vaccine. They were not willing to accept a COVID-19 vaccine at all. And then based on the data collected by the Global Change Data Labs, our World in Data site, we saw that the current situation in our member states shows that between 0.5 and 83% of our member states have been fully vaccinated. and that is at the 25th of November, 2021. But we know that on the lower side, we have Haiti because they had just started their vaccination effort. And then on the higher end, we have the Cayman Islands, who they are at 83%. They started pretty early. So they are now at 83% of their population fully vaccinated. However, when we look at the CARICOM, that should, I forgot to change that. It really should be 0.5 and not 3.5%. 0.5%, and CARICOM is made up of 15 member states. So CARPHA has 26, but the Caribbean community has 15 member states. So when we look at those 15 member states, we are seeing fully vaccinated persons at 0.5 to about 53, or just about a little more percent fully vaccinated. And then the other CARPHA member states, of course, would be on the upper end of the 50s. So interestingly, though, one of the things that we noticed in the vaccine acceptance survey was associations between acceptance of the vaccine with concerns and knowledge about COVID-19. I say that's interesting because a higher level of knowledge was associated with participants in the vaccine acceptance group. And the more knowledge the more knowledgeable, I should say, participants were about COVID-19 and the vaccine, the fewer their concerns were about COVID-19 vaccinations. So there was a significant statistical association there. So then it would appear that inadequate knowledge, or even, I dare say, misinformation about COVID-19 and the vaccine has been contributing to vaccine hesitancy. So much so that the PAHO director, Dr. Carissa Etienne, and some of you may know that Dr. Etienne is from Dominica in the Caribbean. She said, in appealing to persons to get vaccinated, because she was very concerned about the numbers. She said, I don't know the sources of the information that is triggering this level of vaccine hesitancy. I can tell you that they're not scientifically proven. I want to appeal to you to listen to the sources wherever you have truthful, scientifically based information and evidence. So that was an appeal, because she's not the only one, actually. There are several other public health experts who are quite concerned about the rates of vaccination in the Caribbean. The results of this survey showed that the infodemic contributed to concerns in 3 major areas. One was side effects, where we had 38% of the respondents stating that they were very concerned, or they feared the side effects of the vaccine. The other one, which was about 20.7%, is where the persons spoke about the development of the vaccine being rushed. And therefore, they felt that it was not safe. And then there were others, about 19%, that felt that they just didn't know enough about the vaccine. Other concerns included they didn't believe that the vaccine would protect them from getting COVID. So then, if it's not going to protect me, then why should I take the vaccine? And some also reported that they simply didn't trust the manufacturers of the vaccine. And then most recently, especially in Jamaica and Trinidad and Tobago, and these 2 societies in the Caribbean are, I want to say, the most machismo of the Caribbean, even though there were other Caribbean nations who also had this concern. And I'm speaking about concerns around fertility and the potential impact of the vaccine on both males and females. And that created quite a lot of buzz, so much so that it actually took on a whole new life on social media. And that was as a result of just one tweet. So I'm going to share with you a video which shows some of the concerns that I've spoken of here, and some of the misinformation, and some of the postcards and messages that came from our member states in terms of the misinformation that is affecting our region. So I'm going to share that with you, if you can just allow me.
There is no doubt that for some people, after taking the COVID-19 vaccine, that there'll be some minimal side effects. There is that occurrence of maybe some small semblance of pain or fever, which can be a sign of the body building up an immunity against the disease. So yes, for some people, there'll be some discomfort, but I think the benefits far outweigh the discomforts and the side effects that may occur.
Tweeted out that her cousin's friend in Trinidad took the COVID vaccine and then his balls swole and he became impotent. Now, people say wild stuff about the vaccine all the time, but most people don't have tens of millions of followers. So this tweet has caused a giant uproar.
And with those million doses we have administered today, there have only been 5 cases of adverse events, all reported to WHO. None of them includes testicular swelling.
So some of you may be happy to know that the COVID-19 vaccine does not, one of the effects is not testicular swelling, okay? Just saying. So I'm sure some of you would have heard that was seen, that tweet, and I know that Trinidad and Tobago, well, Nikki didn't win a whole lot of fans from Trinidad and Tobago at that time when she did that, even though when she said those words, even though she is from Trinidad and Tobago, and we still love her, but we forgive her. But we will move on. And with all of these different misinformation, myths, lies, and all of these things that were floating around, in the Caribbean, we employed 6 basic strategies that are actually recommended by the WHO for infodemic management. And these strategies, as you see them on the screen here, is to build trust using interventions and messages based on science and evidence. Also to translate knowledge into actionable messages. I'm just going to get rid of this. Yes, so translate knowledge into actionable messages and presenting it in a way that could be understood by all individuals and making these messages accessible to them no matter where they are. So we also reached out to communities to ensure concerns and information needs are addressed. And of course, when you do that, you have to be flexible and be able to tailor the messages along the way. Forming strategic partnerships, I cannot overemphasize that and how important it is in strengthening the impact of information and also amplifying the messages across all sectors. And of course, engaging with communities, again, helping us to understand the circulating narratives and to understand the changes in the flow of information, to get an opportunity to answer persons' questions and also to address misinformation in communities. And then using all of this to further develop infodemic management approaches. So I'm going to go back to building trust, right? And in building trust, All of our CARPHA member states, every single one of them saw the importance of communicating transparently. All of our member states held regular, daily, bi-weekly. In Trinidad and Tobago now, they hold media briefings 3 times a week using spokespersons at the highest level. And that would include the Prime Minister. It would include ministers of health, chairpersons of COVID-19 task force, or the National Emergency Operations Center, and other stakeholders, which would include epidemiologists, physicians, heads of international public health agencies, academia, and civil society organizations. Journalists and members of the general public would also have an opportunity to call and to send in their questions, which would be answered. So communicating transparently is key. Jamaica and St. Kitts and Nevis told of having COVID conversations at a national level. Like other member states, they used social media to amplify the visibility of the conversations via live stream. There was also wide use of radio programs where vaccination focal points in country would address issues and concerns with journalists. Jamaica also used IG Live events and Twitter Spaces where ministry officials partnered with community leaders and influencers. I'm sure you'll agree with me when I say that people relate to people and people connect to other person's life stories. And several of our member states like Guyana and even Barbados used real life survivor stories of vaccinated and unvaccinated persons to translate knowledge into actionable messages. I know that there are at least 1 or 2 of Caribbean unicorns here in the group. And you know, and you can testify that what I'm saying is true, that part of our Caribbean identity is being able to find the funny side of anything and everything. So here again, we're seeing messages being developed and produced with local dialect and theater or drama. We call them skits in the Caribbean, and they're presented in ways that Caribbean people understand and can relate to. So that was also a strategy that was used that was quite successful in reaching persons with their messages. Community outreach and engagement. I'd like to refer to this as beating the streets, because that is what we literally do in the Caribbean. Bermuda shared their campaign. It was called Closer to Home. That's one of them, targeting low-income areas where there was mistrust of government and also low vaccine uptake. So they would go into the communities with their healthcare providers. This would include, of course, doctors and community nurses, influencers, and offer the vaccines. Now, this, even though I mentioned Bermuda here and their Closer to Home campaign, this was done in many of our member states. And they would use that opportunity to answer questions and to address the concerns of the people. This also, I'm told from Bermuda, that it helped to stem the mistrust that some of those communities or persons would have had. Cayman Islands, I mentioned to you before that they had 83% vaccination uptake. And their mantra was go where the people are, simple. They also used the vaccination mobile units to move into the communities. And that was something that has been used not only in Bermuda, but I believe in Jamaica as well. Trinidad and Tobago and Guyana in particular worked with non-governmental organizations to reach migrant Spanish-speaking populations. In Trinidad and Tobago, Guyana, and Belize also, we have a very high volume of Spanish-speaking, Spanish-speaking migrants. In the case of Trinidad and Tobago, they are from Venezuela because we are so close to Venezuela. And there also, a lot of them are low-income persons. So Trinidad, as part of our medical teams, we enlist Cuban healthcare professionals, and these were used, these Cuban healthcare professionals were very much a part of these campaigns. And like Guyana, also partnered with the NGOs like the Red Cross to disseminate information and to get feedback. Now, there's another thing about Caribbean people. Caribbean people like freeness. So at community health fairs, you get a lot of free stuff, free gifts, you get giveaways, and then you get free services. So mental health services, you have blood cholesterol, glucose testing, and so on. So Trinidad and Tobago understood this and used that to attract persons, and then they would upsell, as it were, with the COVID-19 and flu vaccines. And then and of course, community and malls vaccination outreach as well. So going where the people are, in the malls, in the communities, and offering the vaccines there and getting an opportunity to engage. Technology and innovation. Technology was also used for data collection and surveillance, and we see that more prevalent in some of our member states more than others. For instance, Guyana had a rumor tracking tool that was developed by USAID, and they used it to address myths and misinformation on COVID-19 and the vaccines. Bermuda also developed a We Health Bermuda app. It was a Bluetooth, or it is a Bluetooth solution, and it helped them to track persons who and curb the spread of COVID-19, so that persons were actually being alerted if their phones had been near to someone or someone else's phone and that person had tested positive for COVID. And then they would use that to provide actionable advice to the person, whether it is, especially if they were within 6 feet from that person, and then they would advise them whether they needed to isolate, quarantine, or even whether they needed to go have a COVID test. And then monitoring and evaluation, which is a critical part of the whole exercise. I like to say that in the Caribbean, we go back to basics. We don't have a whole lot of resources within our communications and health promotion teams. So we really just go back to the basics and use the basic tools of questionnaires, surveys, also social media polls, whether it's the Facebook poll or Twitter poll, and conversations during our community outreach. One-on-one conversations go a long way, beating those streets in terms of getting feedback, having that two-way communication, and using that to evaluate whether what we're doing is working and informing how we proceed, whether what we're doing is working and then we continue with that, or whether we need to reevaluate, review, and adjust. Because as you know, it is always a process of adjusting, amending, reevaluating, and moving forward. So that's it for me. I want to thank you so much for your attention, so much for listening. I really appreciate it, and I'm open for any questions that you may have.